So good morning, and thank you for having us here today. We'll be doing a little bit of back and forth between Dean and I. So I'm just going to give you a little bit of background in setting the stage for how we started on this path using Care Team, and then Dean will give you a more in-depth look at the platform. So for those of you who aren't aware, the Champlain Dementia Network is representative of various service providers, researchers, caregivers, and people living with dementia from Renfrew County out through to the eastern counties in the city of Ottawa. One of the things that's interesting about this network is that although we do a number of different strategy position papers and laying out multi-year plans, this is also a group that does a lot of very targeted focused frontline sort of activities, from education and training, but right through to different models of service provision. Our vision to 2025 is a supportive community that empowers people with dementia and their families to live well. And every project or every piece of work that we do, we're really trying to consider people's journey right from before they're diagnosed through to different places that they can be accessing services along the way through to palliative care. So the drivers of our work, first and foremost, we're really trying to work from the perspective of what we hear from families and people living with dementia. And I haven't included this slide for today, but I have a series of slides that I often provide in different presentations where I provide an overview of consultations that were done in 2004, then 2012, then 2015, most recently in 2018, where at a local, regional, and provincial level, we ask people what's really important to them and what they're looking for from us, and they tell us the same things over and over again. And so we really, as a network, have been much more focused over the last few years at trying to take action that is specifically related to what they tell us they want. And Care Team is a really good example of one of the things that they tell us. People with dementia, so from a sustainability perspective, we know that people with dementia are driving about 50% of all ALC days. That's probably an underestimate. They have a higher risk of readmission, they have a higher risk of harmful events. So looking at those kinds of key data points is a major driver of our work these days. We know that a lack of support, not support, but support in community leads to placement in long-term care prematurely. So trying to look at how we upstream from a diagnostic perspective, from a community intervention perspective is important in our work. We also know that caregiver burden and distress is very significant in this population, and it's often something, while we acknowledge it, it's not something that we do really well at integrating in our care planning all the time. And they certainly will develop their own health issues. So this is really a key driver of placement in long-term care or admission to hospital as well. The fact that dementia has such a significant destabilizing effect on other chronic diseases is something we consider in all of the work that we do. And we also know that early identification is key for intervention and strategies that can diminish burden and increase quality of life. So when I'm talking about early intervention, we're really focused on how can we be more proactive in how we address the needs of this population instead of reactive. And that can mean from a diagnostic perspective, but it also can mean early intervention when we see behavioral issues or changes in health condition.
So when we're talking about the future of health, what are we really talking about? We're talking about innovation. And in terms of innovation around these 5 different shifts, from when we look at timing, innovation in terms of going from reactive to proactive, from precision, where we have a system where it's one size fits all, and the patient is to fit the system, to more personalized and intelligent. Modality, from institution-centered to care anywhere, continuous. In duration, a shift from episodic and intermittent and siloed focus to, as I just mentioned, continuous and team-based. And finally, the biggest shift, what we're looking at, is a healthcare provider, from that being the power to a people-powered healthcare. Full disclosure, I did borrow this slide from Zaina Kayat from SE Health. So a little bit here to help us set the stage here. In terms of healthcare and technology, I think that we do have to be careful of how our biases slow us down from adapting some of this innovative technology that's coming down. So if we look at this AgeWell survey on aging and technology, what did it show after surveying 2,000 Canadians? That Canadians are confident in using technology, that they are already using technology for health and wellness, and they're using it on a daily basis. And so what can we do here now that we are using, we can take this and really help us to get to our exponential growth that we're looking for. Another study here that is taking our population is using technology, and if we take, sorry, let me pause for a second and regroup here. If we take our patients and families that are using technology and we incorporate the right healthcare providers and include tools, we can reach better healthcare outcomes. So this was a randomized control trial, and it incorporated care system navigators and dementia care experts. And these dementia care experts were advanced practice nurses, social workers, and pharmacists. And what they did is provided support over the phone and internet-based on a monthly basis. And compared to care as usual, there was decreased hospital ER visits. There was increased quality of life for the person living with dementia. And the caregivers had showed a decrease in the amount of depression and caregiver burden. Yeah.
I just wanted to make one more comment too about this population and technology and challenging our assumptions, because we'll speak a little bit more about this, but one of the barriers that we faced when it comes to care team is this assumption that people who are seniors are not comfortable with technology. And over the last couple of years, using the TIPA Snow model around communication and behavioral interventions, we ran a whole series of online caregiver support and education groups. It was offered through the TIPA Snow facilitators. And actually in that situation, almost all of the people who started in that initiative were not comfortable with video technology. And over the course of 5 sessions, at that point, 95% of them said they felt very comfortable with the technology. So I think, and that has now become a regular offering. Dementia Society has trained staff to do that online support. So it was a really good on-the-ground example too, of even when people aren't that comfortable, with a very small amount of support, they can come a long way.
We've made significant advancements in the past 20 years in terms of technology and innovation. But what that has done is it's increased the complexity of our healthcare system. And it's caused, to some extent, some fragmentation in our healthcare system. So we have a significant increase in the amount of healthcare apps and digital support tools. We have patients that are more and more complex, and we have more and more health organizations. So this is without the technology being integrated across the continuum of care and across organizations. We're just creating a more complex system that doesn't speak to each other. And often what we have, as Natasha was speaking to in terms of advancements in technology and digital health, we get this perception that we have less time with our clients, our patients, and our families. And what you'll see here today is that the tool that we're using, Care Team, that we're speaking of, is actually an enabler to get even closer to our caregivers, our patients, and our families. Speaking to the biases, we need to remove our biases that technology is just creating another barrier to us and the patient. So this is from 2017, and it's from the advisory board in the States, and what it's showing is the number of interactions, visits, appointments, a number of interactions in a typical hospital in the United States, and it's around 17,000, clinic visits, 350,000, and home and community care, where it's 2.5 million interactions. And so you don't have to be a mathematician to figure out that really 99% of healthcare happens outside of hospitals. And really what we're looking at is that all of these people, all of this information, all of the healthcare plans are supposed to magically come together to create better health outcomes. And without technology to help facilitate this, it's almost as if we have an orchestra with well-trained musicians and who are all well-intended, but don't know what music we're playing and don't know the conductor. Because in the community, every family has their own life. They have their own circumstances going on, and they have their own health experience. And so patients have many different paths. And really, we're looking at it for a solution that can help everyone on their own path towards better outcomes. You want to add there? So what does the future of health look like? The future of health looks like networking, that we're all interconnected and decentralized, digitalization, and as from our title of our presentation, interprofessional and interorganizational work.
So what we were looking for in terms of this initiative was a way to bring together not just the providers in the previous slide and not just the family and life support components, but to actually have an intersection between those points. So a few years ago, the Center for Aging and Brain Health Innovation basically did a kind of matching process. So they invited providers or networks to indicate where their areas of interest were, and then they provided a series of blind dates with vendors who were doing innovative technical solutions that matched up with where we identified priorities. So this was the genesis for the initial project across the Champlain Dementia Network of Providers, Mackenzie Health, and the Care Team technical solution. And essentially, it's really a collaboration platform. And one of the areas where I think it gets confusing is that this is not a data repository. So we have a number of organization-specific data repositories, and in fact, some organizations do have options to collaborate with their organization and patients and families. But what this does is it knits together across providers, across community supports and natural supports, family and friends, a way for people to communicate. So there's the secure messaging, there's a care plan that's generated, there's tasks that are assigned, but it's not about having one place where every single piece of patient information is. Instead, it brings together that way of saying, so how do we now make a plan and stay on top of that plan through our actions? There's very strong alignment with the Emerging Ontario Health Team criteria related to digital collaboration across families, patients, and healthcare providers. And going back to what I said originally, our primary driver as a network is what people with dementia and families tell us they need. This has been a common message in different forms for about 20 years now, as I said, when you look across consultations. So this was a great opportunity to say, how can we try this out and what might it look like? So we chose Care Team because it really hit the mark on what we were looking for, but it's already been implemented on a larger scale within a hospital in British Columbia, and yet it was early enough in its development for us to really shape functionality. So by that I mean there have been weekly and bi-weekly meetings for the last year and a half, I believe now, where we're doing rapid PDSA cycles to say we're looking for this and looking at how we can then integrate that functionality. It has not always been as rapid as we would like, but they certainly, because of where they're at in their development, that's been a great fit for us. It has the ability to integrate with EMRs. So at Mackenzie Health, they're already with Epic, and that it now does an electronic handshake with Epic. And just building on that idea, one of the things that attracted us to Care Team is they have no interest in developing from scratch different tools or different products. Really what they're saying is, how can we handshake with these different systems and bring the key information together, but not try and reinvent the wheel? Because that's where I think we really start to generate quite a bit of change fatigue and spinning our wheels when it comes to technology. So joining Care Team in the Champlain Dementia, there's basically two things that are required. So the organizations that join complete a privacy impact assessment. So every organization has their own PIA template. Then there's training. So we've developed a series of videos. There's a 3-minute video for caregivers. There's a 6-minute awareness raising video for anyone who's working within healthcare. And then there's a 12-minute video that gives more instruction on how to use Care Team. With that being said, the Dementia Society of Ottawa and Renfrew County has been one of our hugest champions of this project and very much an early adopter. So they've been more than willing, together with Care Team staff, to do targeted demos to specific organizations or provide support in startup. The other thing that people should be aware of is that within Care Team, and you'll see this with Dean's demo, is that over the course of the project now, it has auto-populated templates for care plans. So when Dean's staff, for example, is starting a client's care plan in Care Team, they sign the client up, and there is an auto-generated care plan because we know there are some things that are common across all clients. So it really does save some staff time because then they can go in and tailor it. The same thing has been done for people who are being discharged from hospital. So if a Care Team file was being started for that client, there would be an auto-generated template. We also have a self-registration option for caregivers now. So that comes in a brochure format, again with an auto-generated template. In both of those scenarios, at hospital discharge and for self-registration, they automatically, the Dementia Society or the Alzheimer's Society in Eastern counties, depending on the code they use, automatically gets invited to that person's care plan or Care Team site so that there can be follow-up. And that has been one of the things that's been great about this is we know that referrals are often made to Dementia Society and Alzheimer's Society, but for example, at hospital transitions, we know the numbers aren't adding up with the number of people that are actually showing up at Dementia Society's door, likely because, you know, it's a very difficult period of time. So using this functionality to ensure there's actual warm handoff has been one of the major focuses of our work.
So Care Team's platform is geared around 4 main things. One, the people, so people in terms of the healthcare providers and teams, and the other part is the patient, their family and friends and support network. As Natasha said, it's also geared around the plan. So the plan in terms of what is the healthcare plan, where are they in their journey? We are speaking today about dementia, but it doesn't, the beauty of Care Team is that it could be a plan for another chronic disease. So the plan, what is the care plan? And that's broken down into various different appointments, whether that's a follow-up with your physician or an appointment with a dementia care coach at the Dementia Society. There's various tasks. So whether that could be to tasks to fill your prescription at the pharmacy or to attend an education session. And then there's messaging. So through that, through the people, whether it's a message with the patient, the family, and the support network, and including some healthcare providers, there is messaging and coordination around there. There is an ability for, as healthcare providers, for members of the support network to track progress. So to see if these tasks are being completed, or to see if this document has been read and if there's any questions. So there is ability to track progress. And then as we continue to work with care team, there's will be more and more integration of prediction. So now that they've, let's just say, they're reaching the end stage of dementia, what type of education or support will the family need at that point? So now we're going to try, I'm going to do a little bit of a demo. So I'm going to get off of the presentation slide here. It's a demo site, so you'll see patient names, but they're not real. I think it would be great if you have any questions, or if you want to interact, that's perfect. So I'll actually sign out and then sign back in, but it does work. So from a healthcare provider side, when you sign in, you could have two profiles, so a professional or a personal profile. So I could be using this on my own to support, let's just say, a care plan around my grandmother. But I'm going to enter this from the professional profile, so the Dementia Society of Ottawa and Renfrew County. Perfect. Okay. This is where Natasha talked about, and this has been an improvement from our weekly PDSAs, is that we now have an ability to create an auto-populated care plan. So if I'm supporting Natasha, and she's a caregiver, she's supporting her dad who's living with dementia, or father-in-law, I'm going to create a new care plan for her and invite her. So I'm going to use a template. You could name, and you could have various different types of templates. But first, I'm just going to show you how quickly it is to register someone and get them on board. Natasha, I'm sorry, I can't spell your last name.
That's okay, very few people can.
So once we get to this stage, we really just have all of the information that you can fill out, but we've set up the care plan template so that it automatically populates with someone with information that supports a caregiver who is at Natasha's stage. And so I'm going to first skip through. So there's details, tasks, resources, documents, and I'm really just going to go to show you how quickly and easy it is. If I was to invite Natasha, all I would have to do is put her email in here and go to finish and activate. So that's how quickly and how easy it is to create a care plan on Care Team. Now, let's just say if you were the gem nurse here at the hospital, and you actually interacted with Natasha here because she came to the emergency department with concerns with her father-in-law, and you wanted to get her on Care Team and get her connected to the Dementia Society. You could do simply the same steps by just putting her name and a little bit of personal health information, and then under the invite on the Care Team, invite Care Team, you would see the Dementia Society, and it would automatically include us as part of the care team. No questions yet? Okay, so going into some of the details, Again, everything is really auto-populated here, but you can change it. So we've called the name of the care plan a memory wellness care plan. You can do things like add a diagnosis, whether that's Alzheimer's disease or vascular dementia. In tasks, so this is where, again, in our particular one, we have some initial tasks that are important for everyone when they're first starting out, but we can include a task of an appointment. So that's an appointment with your family physician, can't spell, but, and you could add a description and add a task. And the patient, sure. The patient needs to make the appointment, or if it's with you, you can schedule the appointment and it's there. Under resources, again, these are quick links to resources that would show up on the patient's profile. So to the Champlain Health line, and simply just by clicking, we've pre-populated all of these resources in here. And I'm going to say GPCSO. Under documents, these are PDFs. So these are the handouts that you're giving to your patients or your families, and they're walking away with and maybe losing them, or they're getting crumpled in their purse. So these are documents. So this one is on, we can just view it as an example, but just information on Alzheimer's. And you can always upload your own. Notes and instructions. So this is a standard template where you can add your own notes and instructions. And then we get into inviting the team. As I'd mentioned, we could include the Dementia Society or other organizations as they come on board, and simply finishing and activating the care plan. At the end of the presentation, we'll go over some of the value add of care team, but what we've really found at the Dementia Society, it's actually streamlined so much time and saved a lot of time in terms of supporting our caregivers. Typically, what everyone typically did was we would have a meeting with a caregiver, you'd be setting up an email, adding documents, links, and we'd have feedback that these emails were overwhelming, there was too many links on them, there was too many documents added, and now and that took a lot of time, but with care team, we've integrated as part of our standard of practice for new caregivers coming on that we're supporting. It's actually streamlined the amount of time it takes the team to support a caregiver and follow up.
Could you show maybe?
Yep.
Okay, brilliant plan, doctor's appointment. So how does it interact in real time then to mark progress and so on? Like, how does the plan actually link to, let's say, case notes and stuff?
So that's where, as Natasha mentioned, there is some integration with specific, like Epic or whatnot. There is like the example of what you have from Mackenzie Health.
Mm-hmm. So the integration that's been done with Mackenzie Health is very basic at this point. So when a new patient joins Mackenzie Health through their seniors clinics,
Mm-hmm.
then they are unless they opt out, they're automatically enrolled in care team with the basic information around physician and demographic information, health card, etc. But what I would say about this is the degree to which we integrate or handshake with other systems is entirely within the purview of those organizations and what they want to integrate with. So one of the discussions we've been having with long-term care homes right now is what might this look like in that setting? Because this is something that would be hugely helpful for family caregivers in a long-term care setting. Well, the majority of homes are on point-click care. So if there's a willingness, then we can do as extensive or as minimal a handshake with that system as those homes and that electronic system is willing to do.
When you say handshake, I'm just trying to really, because I think that's a great dilemma, right? 12 these versions of the system, let's say, around Ottawa and Champlain. So I'm just wondering, how do they actually interact? Because everybody's got a different care plan, right? So, but how do you actually bridge it? Or am I back to the magical thinking?
No, it's not magical thinking at all, because that's one of the things, the care plan and the headings can be tailored so that actually they can be consistent with other systems. So that's one of the things we did with the CRIS system, with the HealthLinks coordinated care plan, so that literally on a daily basis there can be push-pull of information. Now, ultimately, we weren't able to move that forward because there were issues at the provincial level, which I now understand have been removed. So we can move it forward. So like I said, it's really about how much do you want to do it. And I use the word handshake because I'm not technical at all. And so for me, that's a way of understanding how this system shakes hands with these other systems and literally can pull data from certain headings into similar headings in care team, but also push back.
So could we look at that, or where that actual handshake happens?
So unfortunately not in this demo. However, yeah, unfortunately not in this demo. I was going to show you what it looks like from the client or provider side, from the caregiver side. But the beauty of Care Team is that it is the one healthcare app. You'd mentioned that there's 13 other ones in this region or whatnot, but it is the one that has the ability to integrate with, whether it's Epic or in the community support network, we use SIMS. So right now we're in the stage of working with Care Team in terms of setting up what the profile looks like, what the care plan looks like, but the opportunities are endless.
And so we are just at a very preliminary stage of looking at how this integrates with Epic here within the region, given that that has just rolled out.
So,
Yeah.
So, but in these early stages, as it grows and develops and evolves, and naturally occur, of course, this is still an app that can be used, utilized in real time by the caregiver, by the patient, and into the doctor's office, following up on that scheduled appointment, for example. It occurs, they log on, they update it, they can even try to, but it's really the self-help management tool.
Yeah, we're giving the
Caregiver and their advocate, right? And is that the idea that they're
I should just stay standing because I'm too chatty. So, but it really, yes, so there's that piece. But then think from a circle of care perspective, the more organizations that get engaged on Care Team, if I'm a community support service and I have this client in an adult day program and they've been to their family doc and done an update that something significant has changed in their health, then it's great for me to be a part of that as well. So it's really that exchange across the everyday happenings and also the circle of care.
So all we need then, for example, is all of those different entities to have access.
Correct.
Yeah.
So that as things come through, things change, they want to schedule something, they can go in, they
Correct.
have the permission, they've completed all of the other privacy, whatever things required, but they become an active member of that community.
Correct.
Yeah, it's coming back to giving the power to the people or to the patient or to the caregivers. And so the important part also is that since it is a patient-centered collaborative platform, the patient and the caregivers actually can make decisions on what certain people see in terms of their care plan. So they can decide that their neighbor only gets to see these tasks that are to happen, and that the whole healthcare team can see all of this, their past medical history that they fill out. So the patients and the caregivers can use it to the fullest of its extent, or use it simply just as a collaboration platform to put appointments in their past medical history. But it is putting the power into the patient's hands. So just briefly from the patients or caregivers' perspectives, and again, this is where we're having a call every week with care team to make some changes as we hear feedback from caregivers and patients. But they can look at their tasks and what tasks they still have. They can look at and they can update them. Would you like to add an appointment to this task? And so you could do that. We can look at who is part of the care team. So right now, obviously, contacts or members. Again, the support network. None. There haven't been any added, but under the healthcare team, we have Justine. Sister, yeah. And then we can look at the care plan in terms of what is under there. There's details, we have a diagnosis, we have some simple instructions on what is the care plan, and we have what the patient's goal, we could add. If I am the patient, I could add what my goal is. My goal is to better understand dementia and what to expect. But it really, I could go on and on about the opportunities here, but it's really the healthcare organizations and the healthcare and the patient or caregivers can use it to as much of an extent if they want or not want. Any other questions from the demo? Yeah?
I'd like to ask you, how close you going to work with a hospital to help this transition patient in the community, especially if there is patient have already dementia and failure or stress, and they're still going home, and let's say geriatric psychiatry being involved, how much information you will have, how this information will be transferred to your care team, and because a lot of work was done in a hospital. And that's my question.
Well, we want to work as closely as possible because that is an important part of that we do have identified is there's gaps in our system is the transition from hospital to into the community.
So this is why we have an auto-populated template for people who are doing discharge planning in hospital or involved. So for example, here at the Ottawa Hospital, your PIA is done. We've done many, many meetings with different groups and would be pleased to do more. So you can do something like invite Dean and I in, and we can actually show you how to start a real client's care plan on care team. You get an auto-populated template. You can tailor that for a client, so you can do the 2-minute option where you're inviting them and then Dean automatically gets invited from Dementia Society, or you can tailor it a bit. So that kind of information flowing from hospital to community, even to have a communications point person, is really, really helpful. And then you can choose to leave that person's care team, or if you have concerns and just want to see how they're doing out in the community during a difficult, what you know could be a difficult transition, you can stay engaged. The other thing is that you need to keep in mind that now that this is becoming the new standard of care in the community, you are going to have people admitted here at the Ottawa Hospital who will already be engaged on care team. So you will be able to, with the family inviting you in, you can then go in and see this information and see who else is involved on the health side, what their tasks are, how they've been doing with things. So that's the first example for discharge from hospital, but we've certainly had discussions with Geriatric Day Hospital, with geriatric assessors around how you start to look at also from an outpatient perspective, how we're integrating this.
And in terms of the population of dementia, it's perfect connecting with the Dementia Society because we're there for the entire journey, whereas other healthcare organizations like let's just say an emerge visit or an inpatient stay, it's more episodic. So we're the continuation of care of support.
Sorry, I have one more point. So just as another example, Vera, so GPCSO is almost done their PIA, right? And so at Dementia Society, they have a generic care team email that you can invite to the patient's care plan. We would want to see similar processes with GPCSO, for example. So you can send the paper referral as well, but this would enable you to click the button to invite that generic GPCSO, the generic Dementia Society, the generic community support service, or what have you, so that you know there's also that warm handoff from an electronic perspective.
I was just wondering how we can help. But as our team was involved, geriatric psychiatry here, the team. It's I'm not saying to everybody because it will be hard, but in very complex patient and their family support, which we know very well, so we might help and help this transition.
Yeah, we can connect afterwards for sure, and that would be great. And I would challenge that when you're talking about time, that you could enroll a family member or a patient on that care team probably quicker than you could send a fax or an online referral the traditional way. Sorry, yes.
So I was trying to get my head around this. Sorry. So I just know from the way I practice, like I was a generalist and a nurse, but quite often people come in and they don't have family members. They tell us that they're already on these care teams. We don't know if they've been seen in a day hospital, if they have a diagnosis of dementia. They can't tell us. They spent hours going through charts and or else families will go, oh no, they don't have a diagnosis of dementia, we do find it. But you said they need to invite us in, but is there not going to be something built in Epic that can be a flag that says they're part of the care team, so I don't have to go and ask them to invite me in, and maybe there's no family to invite me in, and just automatically open?
Absolutely, that can be done, right? So I think that's one of the things with the learnings with the Epic integration at Mackenzie Health. So we really need to look at, as soon as we're able to, doing that kind of building with the Epic here within our region. Yeah.
Hi, so just to build on that Epic piece, I know the big thing with Epic is moving forward, they want to look at the communication with patients and families through Epic, and the appointments are already loaded and all that information. So is this, I'm worried if patients and families have too many platforms that they're expected to use and how it will all be coordinated. So is there the ability that if they were just to go on, communicate through my chart within Epic, that this would automatically be uploaded into care teams, so they're not trying to manage their loved one's care on different platforms at the same time, because that would become really confusing.
As we mentioned before, I think that there is an opportunity to do that. With Care Team, it's a third-party app integration, so it's able to really, the opportunities are endless on what we could integrate and streamline so that there's less duplication. The beauty of Care Team, though, is that there are many healthcare organizations that aren't on Epic and that don't know that plan, don't know when the appointments are. And so the patient or family do have an episodic interaction with the Ottawa Hospital, let's just say. But what happens when they're in the community afterwards and they're connected with other organizations that aren't integrated on Epic? So Care Team does provide that bridge across organizations and across platforms so that we can collaborate more.
And that is the appeal of this system. So it's actually about how do you bring together all of these different disparate options that are organization specific. And one of the things that I found almost alarming in the initial readiness assessment process with the Ontario Health teams is that there are so many organization-specific portals, and some of those may eventually expand, it's true, but what we actually need is a platform that has that flexibility to bring together from across. And if you're not reading the subtext yet of what we're saying here, our subtext is The more that we have organizations really engage with Care Team and start using it with their clients and caregivers, the more we can really move forward on building some of these bridges. So I think one of the things that has been challenging in implementation is we have had to wait for the right moment. So the right moment 6 or 8 months ago wasn't then, right? That was the right moment for working closely with Dementia Society. But at this point in time, it really feels like there is a good opportunity to move into the next phase, and we can only go as far as organizations are willing to go with us. Yeah, we have more slides.
So just for those who have the printout of the slides, there's just some screenshots of what I went through in the actual demo. So you have the different care plans, you can see the task lists and the support team and who's involved. Just want to skip through. So this is what the messaging looks like. So it's basically like a group chat on your iPhone, or if anyone's using Slack out there, you can create channels that I want just to chat with Natasha and I, or I can include the entire team on your profile. And so we've already set it up so that you could include the Dementia Society as if there was a Care Team profile started here in the Ottawa Hospital, you could include the Dementia Society as part of the team. So we just have a few slides left just to talk about our challenges and what are the opportunities, and I think we've integrated them throughout the presentation, so it will be a good way to close it off here.
So I think that cartoon really represents what's been one of our biggest challenges in implementation, is that there have been so many different initiatives, so many different electronic innovations that have actually been quite costly from a time and effort perspective, that it is really difficult to get people onboarded onto this system. But we're really starting to get some traction now. And the way we've done that is really understand how Care Team fits in existing workflows, because that's where you can really start to identify where there's efficiencies that can be gained. We've been really fortunate having some great early adopters for Care Team who have been champions for the system. Although it is an easy-to-use system, certainly there's more targeted training that's required for some people.
And just the point for that one is that it's not that you need significant more training, is that you have a champion on site who could walk through with a few individuals and take an extra minute or two to help kind of orient to the system. So it's not that it's more complex than what we're saying.
That's right. And I think having that lead champion within your staff makes a big difference, and we certainly saw that at Dementia Society. The implementation of this tool has highlighted practice gaps within the system. So even around issues around referrals between organizations or hospitals, that has certainly taken some additional time to work through some of those bugs. So just from a value proposition perspective, because I'm keenly aware of the time, just to summarize, the potential around information sharing during transitions of care is substantial, and certainly as people become more complex as their disease progresses, this makes a big difference. It provides a mechanism for that ongoing care planning, as we said, between the life group, the family group, the natural supports, and the healthcare services. It's a great communications facilitator for family who are out of town or during work hours. So, for the person with dementia who has the opposite problem of no family support. Instead, they have multiple family support and they all want to speak directly to the physician or the nurse about what's going on. This is a great option. It incorporates that full circle of care. There's the scheduling even of appointments or rotation of visitors if the person lives in long-term care. And it really builds a cohesive approach and understanding to not just what's the paper care plan that the person has, but how are we actioning this as a team?
So and just to finalize with some opportunities. So what we have noticed from implementing Care Team into our standard of practice is that it is a significant time saver. whether that's setting up support for a patient and a family, and then in addition, following up with them as well. What we're hearing from our caregivers and persons living with dementia, as Natasha said, that's what we're looking for, is that they're really enjoying that it's a one-stop shop for all of, like a resource hub for everything that they need. Not only do we add resources and links, but the family can also add their own as well. So when they're educating other family members that are in their circle of support. We can look at opportunities for nudging, so behavioral nudging for updates from clients, follow-ups, or general information of that this talk that Dr. Andrew Frank is giving is coming up in the community. There's an ability to self-identify as a caregiver or a patient. Right now, Care Team is focused that the name on the Care Team, on the care plan is the patient, but from the Dementia Society's perspective, there's also many caregivers that we're supporting that just want to use Care Team as part of their own care plan. And then, as we'd mentioned before, part of the discussion is ensures like a warm handoff and follow-up in terms of closed-loop communication, so that really no one gets left behind. Just to close off here, we're right on time. Just wanted to say thank you to everyone. And if you have any questions or if you'd like any follow-up, Natasha and I'd be happy to connect with you to see how we can collaborate together around Care Team.
So thank you, Dean and Natasha, for a great presentation. And